Okay, so now welcome back to my channel. It's been a while. Yeah, it's been a while. It's been a while. So anyway, today I'm gonna be talking about what I feel it's very important when you are moving into a foreign country, particularly when you're moving into Ireland, what you need to consider when you're in regard to your health. So please, if you haven't subscribed to my channel, do so and comment and share this video, as I have had a lot of comments of people wanted to know things that they need to do if they are moving into Ireland. So in a positive sense, I have people actually contacting me and say, I've watched your video and I'm in Dublin because you gave me a bit of guidance. So that is my intention on this platform. So if you have intentions of moving to a foreign country, please consider investing in your health. So now we have a website, citizen information, when you are in Ireland here. It's very informative website. It has all the information that you could possibly need. It's called citizeninformation.ie. So I will be kind of highlighting things from that website that you're going to need to consider when you're moving into Ireland. Healthcare services. I haven't been feeling well myself. You can see my son had smallpox, so he gave me smallpox. But I just thought, you know what? People might be traveling to Ireland and they don't know what if they happen to get sick, what they are going to do. So my focus today is going to be on health. What do you need to do? Thank you. Thank you so much for watching. Please share this content, comment, and okay, so I'm gonna be reading something out of this website called Citizen Information. So it states that if you are a student from a country outside the EU, the EEA, Switzerland, or the UK, you are generally regarded as ordinary resident. If you are registered for a course of a study that will last for at least 1 year, one academical year. So what that means is that if you are registered here or as a student, you are now a resident. So they would look at the fact that you are paying tax, you are working, and they will look at the fact that how long you've been working in Ireland. So those kind of things, they are very important. Like I said, first of all, at the immigration, they would ask you for health insurance. If you don't have it at the office, they won't ask that. Okay, so I'm gonna be coming in from a student point of view because, like I always say, I am gonna be talking about my experience in Ireland. So I think they do have two options. You can avail for free health insurance when you have been living in Ireland for more than a year and you've been paying tax and you've been working. But there is also, if you're coming in as a visitor, it depends on which part of the country or which part of the world you're coming from. So I'm going to be focusing people who are not EU members or who are not from the UK or who are not from Switzerland. They do have a free in some kind of entitlement to a healthcare system in Ireland. But if you are coming in as a foreigner from non-EU countries, you don't have any free entitlement to any healthcare center in Ireland. So as a student, first of all, when you go to the immigration, after you've been here, you've passed through the immigration officers and everything, and you have to go back to the immigration offices to register that you are intending to stay in Ireland for more than a year. So one of the requirements at that registration is your health insurance. So that health insurance is to cover up for any kind of major health issues that you might have. But if you have any kind of maybe you're not feeling well, maybe headache, you want to go to the doctor, that health insurance doesn't cover that kind of services. The reason why I'm mentioning that is because my own health insurance from back home would cover that kind of services, but this one, it's only when you have very huge bill to pay. So that's one of the reasons why I might have to mention all that to you. So if you are to evade to or access any healthcare center, you have to register with a doctor. Any GP here would be happy to register you if you have proper residential permits to stay in Ireland. They would have, depends on what's going on when it comes to your health. They have, it's between 50 and 60 euros for consultation, and then it depends on what is it. And then prescription, you pay for those prescriptions. Like I mentioned, your health insurance that you registered from the immigration, they cover very large bills. So recently I had to avail such health insurance access through my son, because I had to register him. I have been paying for his medical health insurance while he was at home, but because he had some medical conditions, his skin and everything, it depends on what kind of cosmetics, whatever he needs, that they can cover. But if it's just luxury cosmetic issues, they don't cover that kind of services. But when it came to him, they looked at his conditions and they said, okay, we can cover him. I've been paying for that insurance for more than 8-10 years, even when he was back home, because I knew if he needs any kind of medical services, I can bring him here and he can avail to that. Yeah, so these websites continue to say that if you are not ordinary residents, that is, if you haven't been living in Ireland for more than a year, you are not entitled to healthcare under any circumstances described above. You may have to pay the full price for any services provided. In case of hardship, the NHS may provide urgent necessary treatment at a reduced charges or without charges. So it depends. They might reconsider to pay for some of your charges, so it depends on your conditions. But one thing that I know for sure is that when you are here, they would not close the door on you. They would help you first, and then you can have to make any payments for any kind of a bill that comes your way. So they don't, where you are being refused for medical health issues here. That doesn't happen here. They attend to your health issues and then they look for your money after that, for their money here. Okay, it says if you can show the NHE that you intend to live in Ireland for at least a year, you will be regarded as an ordinary resident, and you will be eligible for either free or subsidized health services. The NHE may look for evidence that you are legally entitled to live here for at least 1 year. So they're gonna look. It's either for, if you're a student, for proof of your letter from your college, or if you work here, they might want a pay slip or things like that it can prove, or your tax forms or anything like that they may say that they want a proof that you are actually here for more than a year in Ireland.